Leah Walters, great to have you with us today. You're an RN with Mountain Valley Regional Rehabilitation Hospital. And so you know all about these like nasty flu germs. And it seems like it's still cold, it's still dark in the morning. We still have to watch out for this doggone flu thing, don't we?
Absolutely.
Oh, no fun. So, where do we start? Like, what of the symptoms? Because I don't know, is cold different than flu or what? What are we looking at when we get the flu?
So the cold and flu symptoms share many of the same symptoms. The biggest difference is the severity of those symptoms. A cold can kind of develop gradually over a couple of days. Usually those symptoms are mild. You'll get a runny nose, maybe a stuffy nose, a cough, a sore throat. The flu, on the other hand, those symptoms tend to be worse. There's a great acronym for those symptoms, and it's the word FACS: fever, aches, chills, tiredness, and sudden onset. In my opinion, the sudden onset really is the biggest indicator that you may have the flu, because one minute you'll feel fine, and the next minute you'll just feel like you've been hit with a ton of bricks.
Wow. So you're not getting the sniffles, or you're not saying, well, I don't feel good. All of a sudden you start aching and
just aching, body aches. Yeah. And that's where that tiredness kicks in, and all you want to do at that point is sleep, because you're just so tired.
And that's what your body needs, obviously, to heal, probably, which is good. Plus, it takes you out of circulation.
Yeah,
because,
absolutely.
You can spread it easily. We'll talk about that. But so, what are the complications? Flu, is it more dangerous than having a cold in some ways, Leah?
Absolutely. The complications from a flu, from sinus infection, ear infections, to pneumonia. And if you're an individual with congestive heart failure, asthma, diabetes, it can worsen those symptoms and lead you actually in the hospital if not taken care of properly.
So those people have to really be careful when this season, seems to. Is there a season? I have to ask, or is it kind of all year?
So with the cold, you can catch the cold all year long, whereas the flu, it is seasonal. It's October to March. Actually, this month, February, is the peak flu activity.
Yeah. Watch out, oh no. Okay, so how do we prevent catching a cold or the flu? Is there some magic formula, Leah? Help us.
So the best defense really is getting the flu vaccine. That's the #1 thing that you can do. For the flu, there is no vaccine for the cold. So for both of them, staying away from sick people. If you know somebody is sick or apparently sick, stay away from them. Covering your cough and your sneeze is very important. Those germs really can spread a great distance, 3, 4, 5, 6 feet even.
Oh, isn't that amazing? You wouldn't think it, because you may not feel it or anything. You're just like, oh, bless you, or whatever.
Yeah.
But it's still kind of blah.
Yeah.
Okay, so now I have seen people, and this is kind of weird, we were talking about this earlier, who, they'll bump fists. They're like, hey, Leah, how you doing? Or nice to see you. They'll bump like elbows. And that, I think, is to prevent like the handshake where you pass possible germs that you might have on your hands to each other.
Absolutely.
Is that reasonable?
Well, limiting actually touching items when you're in public, I don't know. I mean, there's something to a nice handshake, in my opinion. Just wash your hands afterwards. Really, that's all you really need to do is wash your hands. Or there's hand sanitizers.
Yeah, people pull those out of their purse.
Yep.
And, they're always hand sanitizing.
Absolutely.
So is that good? That doesn't weaken your resistance when you use an antibacterial, does it? It's good
No,
still?
it's actually, if you can't get to a sink, that is the preferable method if you are not going to be able to wash your hands with soap and water. I have a son who's 14, and he thinks just passing them through water is good enough. So I know that's not going to do it. So he has a big, nice jar of hand sanitizer.
Well, I know they keep them at school and everything now. And I think they have some that aren't alcohol-based as much, and so they dry my hands out. So anyway, just a little aside.
Yeah,
that's okay to say. Okay, so sometimes no matter what you do, no matter how careful you are, if you're out in public, if you're around people, heaven's sake, if you go to a school, bless their hearts, children are just little walking petri dishes sometimes. And so, because they're just getting everything, they're just getting immune to things, so they catch them. But
absolutely.
So if you get it, what treatment do you do for cold and for the flu?
So for the cold, really it's just managing those symptoms. Over-the-counter medications like a decongestant, maybe a Mucinex or antihistamine, maybe more like a Benadryl. It's just managing those, but staying home too.
To be more comfortable.
Getting rest, drinking plenty of fluids.
And being considerate of everybody, because you don't come out and sneeze on them or
that's right.
expose
That's
them.
the best thing really people can do.
Okay.
And then for the flu, really it's follow up with a physician. There are antiviral medications out there like Tamiflu, but those are best when given within the first 48 hours. And that will shorten the duration of the flu and limit those complications.
Okay, so when it hits you, because the flu comes suddenly, say, oh my gosh, it's Tamiflu?
Tamiflu.
Tamiflu.
It's only prescribed by a physician, and maybe the physician may recommend something different, but that's a real common one we see here that comes out of our local hospitals and our physicians.
So better than just an over-the-counter something.
Yeah,
when you've got the flu.
When you have the flu, they're really, I mean, you could help, again, manage those symptoms with an antihistamine, but if you truly have the flu, I mean, that could last 1 to 2 weeks.
Knock it early.
Yeah, so you want to shorten that. And that can happen with the antiviral.
Yes, because we don't like to feel badly, okay? It's just not really fun. So let's get through February with no cold or flu.
Yes.
Okay. Leah Walters, registered nurse with the Mountain Valley Regional Rehabilitation Hospital. Thanks for joining us.
Thank you.
Great tips, things we need to know right now.